like to call Thursday, October 14th, legislative session in order. Will the clerk please call the roll?
Michael Yerden.
Present.
Herbert Yerden.
Present.
Edward Gilson.
Here.
David Holz.
Here.
Roy Rehill.
Here.
John Martino.
Here.
Bradley Trudell.
Here.
Paul House.
Here.
James Weatherup.
Here.
Mary Ellen Chesbrough.
Here.
Linda Lockwood.
Here.
Richard Klein.
Present.
Patrick Twist has been excused. Stephen Walpole.
Here.
Nathan Emmons.
Here.
Thomas Drum.
Here.
Lori Nagano.
Here.
Robert Wilmot.
Here.
Marie Shaw.
Here.
Tim Stahl.
Here.
Terry Wilbur.
Here.
James Karasik.
Here.
Morris Cervello.
Here.
Mark Greco has been marked excused. Ralph Stacy Jr.
Here.
Mr. Chairman, you have a quorum.
Thank you. We join with legislator Ralph Stacy for the invocation.
Dear Heavenly Creator, we pray that you will guide us with your wisdom always. We ask that you help us to satisfy the needs that need to be met during this here meeting. We ask you to strengthen us as we make tough decisions. We pray that we will be like a well-watered garden, like a spring whose waters never fail. We pray that we will be fruitful. Please guide us so this meeting be productive and will benefit the people of our great county. Let us be effective and decisive. Amen.
Thank you. We now join in the pledge. Pledge of
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. And we all had a chance to review the minutes of the legislature meeting from September 9th.
Make a motion.
Motion and second. Any discussion? All those in favor?
Aye.
Opposed? Thank you. Just prior to the meeting, we had a number of proclamations, some recognitions. I think I'd be most proud of the fact that we've had some employees have been here 25 and 30 years, and they're still willing to come to work. That's good. Moving on now to public speakers and resolutions of the day. Okay, when I call your name, you're going to be able to come forward. In the interest of fairness, you're going to have 5 minutes to speak. So, with Lynn Thompson, come forward. Right up here, sir.
Good afternoon. My name is Lynn Thompson. I live at County Route 57 in Oswego, New York. I live across the road from a rookie property, which I've been to the county garage maybe 5 times. Tried to get a hold of Mr. Oswald on the phone maybe 6 or 7 times with no responses. I've talked to my legislator. There's boats on the side of the road. There's trailers there. There's a big pile of dirt that was dumped out there from when they tore the jail down. That's 5 feet from the road. I want to know why I can't get this stuff moved off the property, off the county right away. I've been to the town of Bounding trying to get them to do something. I can't get anybody to do anything for me, so I'm just trying to see if I can get some help from somebody to get this taken care of. I mean, these vehicles are within, I think they're supposed to be like 35 feet from the center of the road, where there's not supposed to be anything because it's a right of way, and this stuff's been sitting there for years. The one trailer's been there for at least 5 years. There's another boat there with a bunch of little motors on the back. It's basically a junkyard. I don't know why we have zoning rules and stuff like that, and nobody can make these people clean this property up and stuff. I've had the DEC in there asking them to do soil samples. They said they need a warrant to do that. So I don't know what to do with this property, but I have a beautiful piece of property and they live on the river, and I have to sit across, have to look at this at all times, and they think, well, they're grandfathered in for what, a junkyard? Because that's basically what it is, and I would like some help from somebody to get this cleaned up. I mean, I know we have zoning rules and everything, and I've been to board meetings in the town of Bounding. That's a waste of time. so I'm getting nowhere with this. So, I'd like something done. I talked to Bobby, my legislator, he's trying to work with Kurt Asphalt or whatever. Every time I try to get in contact with Mr. Asphalt, he's either in a meeting or whatever. I left him messages to call me back. So I just want to know why he won't do his job and follow through. He told Bobby that he was going to have somebody go out and do some kind of engineering study or something. That was like 3 months ago. Evidently, he hasn't done anything. And I've been out to, like I said, the county graduate at least 5 times. He's always in a meeting. I've called him more than 5 times. He's always in a meeting. Never called me back. I mean, the guy's got to do his job. So, you know, whatever. So that's basically all I have to say. I would like somebody to look into this and get it taken care of. I mean, this stuff is right next to the side of the road. Basically a junkyard.
Okay, but you have talked with the town about it.
Oh, I've been to town, I was there when Mr. Lockwood was alive, I've been there with Greg, I've been there with Dan. My wife and I were just there 2 months ago for a meeting, and I get nowhere. Nobody wants to do anything. Like I said, I had the DEC in there, and they try to say, well, they need a warrant to do soil samples. They're working on boats over there all the time, they're not zoned to, they don't have a DBA, they're not zoned to do business, but they're trying to say they're Godfather's in. Well, Godfather's in for what, a junkyard? I mean, I don't know if you, I know there's a lot of people that are familiar with the property and stuff, and it's a junk, it's terrible. You know, I just like something, you know, somebody could do something about it, look into it, try to get it taken care of. Okay?
Thank you.
Okay, thank you, appreciate your time.
Legislator Regan.
Mr. Chairman, I would ask that you make sure that folks are speaking on the resolution of the day. Other comments would be at the end of the meeting.
We're just about to offer that. Jacqueline Lowell, whoever signed up second. And again, you are speaking to a resolution. Thank you, you have 5 minutes.
I am Jacqueline Lauer. So I didn't know that you were actually going to have a resolution on this today. I was going to come here anyway and speak after the meeting. So this is. Okay. So I just saw that you were already talking about opposing COVID-19 vaccine mandates opposed by the federal, state, and or local government bodies on your agenda, and I'm happy that you're talking about it. I was coming here anyway to talk about it. And I have to say, I never, ever would have thought that I would be speaking on this or fighting for medical rights in the United States. I've been speaking with many people in the last month, including state workers, nurses, county workers. These people are different in many aspects. Some are Democrats, Republicans, some are spiritual, some are not, some are single, some are married. They all have medical backgrounds that are different. They have different issues, of course. They've all taken the last 2 years' events and have spoken to their doctors and pastors about important medical decisions that they need to make for themselves. And I think it's appalling that an employer would threaten to fire somebody over something so personal, or that our government would push an agenda on citizens' lives. And I'm asking for you to stand up for us. We've all felt pressure to make a medical decision to get what we want or what we need, and this shouldn't happen in this country. I've seen young people go against their doctor's advice because they wouldn't have access to their college classes. I've seen people who choose to get vaccinated get ridiculed and ostracized at work for carrying the virus to others. I've seen people get pulled into offices and told to wear masks because it was rumored that they weren't vaccinated. And I've seen friends struggle with their workload because their coworkers were fired for not being vaccinated. I've seen people in public and at work verbally attack others for not wearing a mask, and the discrimination is really getting to me. We have a right to privacy. We should not have to disclose what happens in our doctor's offices to keep our employment, nor should we be treated differently at work, in schools, nor in public for that matter, depending on what happens in our doctor's offices. We need to keep our right to make our medical decisions, keep them private, and not to have to dress differently based on our personal medical decisions. Thank you.
Thank you. Next, we have Sharice Wills. Thank you, Jim. Related to the resolution, you have 5 minutes.
Hello, thank you for this time. So I'm speaking on the same thing that Jacqueline just did. She did very well. She really expressed every view that I have as well. This is a difficult time, I think, for everyone. Difficult decisions, but I'm not really understanding what changed in our country, why we are, why this isn't kept to be a private decision between us and our physicians. It shouldn't have to go beyond that. What happened to our freedoms, our rights, and our privacy, I just don't understand. There are a lot of people that are afraid of the virus, afraid of the vaccine, or shots, anything. People have all sorts of fears. I'm not responsible for your fears, and I'm not responsible for your health. And I don't think it's right for us to put that on anyone. It has done nothing but create difficulty in relationships, at work, with family, friends, communities. It's torn people apart. People have been very mean to each other over all of this. What we have to remember is that our health is our responsibility. I can't ask you to be responsible for my health. That's just ridiculous. We need to be responsible and take responsibility for our own health, our choices, and we need to do what's best for us. No one knows what we go through, what our medical history is, what allergies we have. There are lots of reasons why people wear masks, why people don't wear masks, why people take shots or medicines, and why people don't. There are reasons on both sides, and because of that, it should be left up to the individual. It should be kept private, and it doesn't need to go further than that. We shouldn't be afraid to live next to each other. I'm not responsible for your fear. I'm sorry if someone's afraid. People are afraid of all sorts of things. Triple E, Lyme's disease, heart attacks. Life is a risk. Getting out of bed every day is a risk. You could break your neck. You could get hit by a car. A plane could crash and kill you. A lot of these things have happened recently. They've been on the news. So we need to choose for ourselves how we're going to live. If you want to live in fear, if you want to blame others, that's your responsibility. That's your problem. If you want to be brave and go on living, then be brave and go on living and stop blaming others for how you feel and your struggles. That's not fair to anyone. Just please, I just ask that in our prayer today, it gave me hope that we will keep praying, seek His will, provide for our community, protect our freedoms and rights that He has given us. Thank you.
Thank you. Next, we have Chris Davis.
It's not on a resolution?
Yeah.
Okay.
This is it.
Memorial.
Then you can go at the end.
At the end, there's a
Yeah.
Mimi Goulet.
No, sorry.
Okay, moving now to reports of county officials. Reports of standing committees. Reports of special committees. Moving then to resolutions and motions, government courts and consumer affairs. Legislator Holt.
Mr. Chairman, I offer this resolution for first adoption.
Will the clerk please read the heading?
Resolution awarding professional services contract, RFP 21-AC-002, forensic psychologist consulting services.
The County of Oswego awards a professional service contract providing forensic psychologist services, vasculitis, psychological service, 7854 Oswego Road, Liverpool, New York, as per the attached resolution.
Thank you. Any discussion? All those in favor?
Aye.
Opposed?
Mr. Chairman, that's 23 in favor, 0 opposed, and 2 excused.
Thank you. Resolution GC2 by legislator Holt.
Mr. Chairman, I offer this resolution, urge its adoption.
Will the clerk please read the heading?
Resolution awarding professional services contract RFP 21-AC-003 electronic voucher system.
The County of Oswego awards a professional service contract for providing electronic voucher systems to Jana LLC of 6216 Oswego Road, Syracuse, New York, at a cost of $2,000 per month.
Thank you. Any discussion? All those in favor?
Aye.
Opposed?
Mr. Chairman, that's 23 in favor, 0 opposed, and 2 excused.
Thank you. Resolution GC3 by legislator Holt.
Mr. Chairman, I offer this resolution, urge its adoption.
Will the clerk please read the heading?
A resolution fixing time and place for public hearing relative to proposed County of Oswego Local Law Number 2 of the year 2021, entitled A Local Law Establishing the Office of the Oswego County Public Defender.
This has to be amended so the date reads November 10th, 2021.
Second that motion.
Okay, thank you. Is there any discussion on the amendment? All those in favor?
Aye.
Opposed? Carried. Back to the original. It's just setting the date for the public hearing. Correct. Right. Any? Excuse me?
Just November 10th.
Any discussion? All those in favor?
Aye.
Opposed?
Mr. Chairman, that's 23 in favor, 0 opposed, and 2 excused.
Thank you. Resolution GC4 by legislator Holt.
Mr. Chairman, I offer this resolution, urge its adoption.
Will the clerk please read the heading?
Resolution establishing the Office of Strategic Initiatives and establishing associated positions to be funded by American Rescue Plan Act funds.
Okay, at this time, we're going to name David R. Turner of Oswego, New York, be appointed as Director of Strategic Initiatives at grade 70, step 25, $112,465 for a term to coincide with the term of this legislature.
Thank you. Any discussion? Legislator Schott.
Mr. Chairman, who will determine the mission statement of this strategic initiative?
Actually, the legislature determines that.
You don't believe that this can be done in community development? That a new
We
group
believe,
needs to be formed?
we believe there's significant differences between that office and what this, we hope to accomplish with this office.
I just feel it's, way over $1 million investment for one position over 5 years, and I oppose it.
Okay, thank you. Any other discussion? All those in favor?
Aye.
Opposed?
Mr. Chairman, that's 21 in favor, 2 opposed, and 2 excused.
Thank you. Resolution GC5 by legislator Holt.
Mr. Chairman, I offer this resolution, urge its adoption.
Will the clerk please read the heading?
Resolution opposing COVID-19 vaccine mandates imposed by federal, state, or local governmental bodies.
This is for the Oswego County Legislature, believes it's a responsibility to educate the public based on the facts, and it's not the county's, states, and federal government's responsibility to create mandates that force the general public to accept COVID-19 vaccinations against their will.
Thank you. Any discussion? Legislator Drummond.
Thank you, Mr. Chairman. I'll preface my remarks by stating we've had some members of the public come in and discuss this issue today. I respect their right to discussion. I respect their right to discussion. I just disagree. I'm incredibly disappointed, not surprised to see this resolution before the legislature this afternoon. It seems this body has made the decision to ignore common sense This resolution highlights vaccine mandates in its headline, but when read in full and understood clearly, President Biden's emergency measures allow for weekly testing in lieu of vaccination, something that I think is important to note and is often glossed over time and time again. Regardless of that, it's my opinion everyone should get vaccinated, plain and simple. If you're going to make the choice to not get vaccinated, I believe something like weekly testing is more than reasonable. More so, as it pertains to the legislature, I'm disappointed to see us play into this political football. I've said this before, and I'll say it again. During these contentious political times nationally, local government should sift through the politics and stick to the facts and science. 700,000 dead nationally, 100 of our neighbors in Oswego County lost, 500 plus new COVID positives in the last week, which completely bucks the national trend of decline. And we're deciding that this is the resolution that we need to be focusing on today. Shame on us. Shame on us. With that being said, I refuse to waste any more of the legislature's time on this nonsense. Feel free to debate away. I've said my truth on the matter, I've said it here on the floor, and I've said it in the committee. My friends who cry personal freedoms and socialism, frankly, they're full of hot air. I can't think of anything more patriotic than caring for one's neighbors. In closing, I'd like to thank the Oswego County Health Department and apologize to them in person that this is what we're focusing on as a body. You all have moved mountains during this pandemic. Today, we should be focusing on resolutions that encourage age-eligible citizens to receive their boosters. Instead, we focus on this political football. With that being said, Mr. Chairman, I strongly oppose this resolution and would ask for a roll call vote on the matter. Thank you.
Thank you. Any other discussion? Legislator Gilson.
Thank you, Mr. Chairman. Despite the dangerous socialistic rhetoric that's going on in our federal capital and our state capital today, I find it very rewarding to belong to a governing body that still stands up for freedoms this country was founded on. These are very difficult times, unlike many of us have ever seen before. Our election integrity is called in question. Our ability to have input to our children's education is denied. Our very liberties to make personal choices are being trampled on. We've seen in this chamber testimony after testimony, and again today, our constituents that have come here that have found it important enough to address us and ask us for the Constitution of the United States to support our rights. The fact that our department heads, this legislature, our community employees have done a wonderful job managing us through this. And you, Mr. Chairman, have done a wonderful job leading us through this pandemic. Our health department has educated, communicated, provided for testing, provided for vaccines to those eligible and those that have made the personal choice to get that vaccine. And it is a personal choice, and that's really what this liberty is about. I made that personal choice. It was my right, as it is the right of everyone in Oswego County and our nation to make that personal right. I'm proud to be here today to support our citizens in maintaining those rights and those liberties. And I think if we vote today to pass this resolution opposing vaccine mandates, we can all go away proud knowing that we've done a job for our citizens. Thank you.
Thank you. Any other discussion? Legislator Evans.
Thank you, Mr. Chairman. I stand before you in support of this resolution. If the legislature would bear with me, I will give you the reason why. As it was stated in 1776, when in the course of human events it becomes necessary for one people to dissolve the political bonds which have connected them with one another, and to assume amongst the powers of the earth the separate and equal station to which the laws of nature and nature's God entitle them, a decent respect to the opinions of mankind requires that they should declare the causes which impel them to the separation. We hold these truths to be self-evident, that all men are created equal, that they are endowed by the Creator with certain unalienable rights, that among these are life, liberty, in the pursuit of happiness. That to secure these rights, governments are instituted among men, deriving their just powers from the consent of the government. That when any form of government becomes destructive to these ends, it is the right of the people to alter or to abolish it, and to institute new government, laying its foundation on such principles and organizing its powers in such form as they shall see most likely to affect their safety and happiness. Prudence, indeed, will dictate that governments long established should not be changed for light or transient causes, and accordingly, all experience hath shown that mankind are more disposed to suffer while evils are sufferable, than to right themselves by abolishing the forms to which they are accustomed. But when a long train of abuses, pursuing invariably the same object, evinces a design to reduce them into absolute despotism, it is their right, it is their duty to throw off such government and to provide new guards for their future security. That is our Declaration of Independence. It is not just a barbecue that we have every July 4th. We have not a responsibility, we have an obligation as this body to say no to any mandate that violates this very declaration and our Constitution. We have an absolute right, as our forefathers said, to life, liberty, and the pursuit of happiness. Mandates are a violation of that liberty. I commend this legislature for standing up. I would encourage every employer, every citizen, to start using the word no when it comes to these mandates. They are unconstitutional, and they are a violation of our absolute liberty. We, as a country, believed in that liberty at one point. We need to believe in it again. To live in our society, it is a risk-reward proposition. Liberty is risky. It is riskier than other forms of government. As Americans, we have to balance that risk. We have to defend our freedom. Freedom is the absolute cornerstone of our society, and we need to stand up as a legislature to defend it. Thank you.
Thank you. Legislator Willard.
Thank you, Mr. Chairman. I'd just like to draw the body's attention to a few news headlines and facts that are out there that are a little bit different than my colleagues have already brought forward. The fourth whereas in this resolution has whereas staff members within the medical field have lost their jobs in these chosen fields of employment with the mandated vaccination. So I'm going to put out some numbers here just to prove a little bit and then share a few other things here. Upstate University, 120-minute wait. Upstate Community, 235-minute wait. Over 4 hours the day before. This is how long our local ambulance service had to wait at our Syracuse hospitals with patients. All fell through this situation that we're in right now. September 24th, Upstate University Hospital shutters its OR, blaming New York vaccine mandate for staff shortage. They temporarily closed 22 of its 35 operating rooms in response to the COVID vaccine mandate. September 25th, New York preps for staff shortage with healthcare vaccine mandate. So we knew that it was coming when the governor and the president put this into place. Unfortunately, in our medical industry, we're seeing more and more what the consequences are, the negative consequences that is facing our area, our county, the safety of our individuals and the health care of our individuals that we should take so seriously in mind when it comes to these types of dramatic legislative changes from afar, both at the federal and the state level. I can't compare with Legislator Emmons on quoting every verse of the Constitution. My hat's off to him on that. I'm sure maybe he had a little help with that as well when they put some paperwork in front of him. However, I stand for that Constitution, I stand for the flag, and I'll be supporting this resolution opposing this mandate because I think it is wrong.
Thank you. Any other discussion? There being no other discussion, a roll call vote has been called.
Michael Yurden,
It is my privilege to vote yes.
Herbert Yurden,
Yes.
Edward Gilson,
Yes.
David Holtz,
Yes.
Roy Rehill,
Yes.
John Martino,
Absolutely yes.
Bradley Trudell,
Yes.
Paul House,
Yes.
James Weatherup,
Yes.
Mary Ellen Chesbro,
Yes.
Linda Lockwood,
Yes.
Richard Klein,
Affirmative.
Patrick Twist has been excused, Stephen Walpole,
Probably support this.
Nathan Emmons,
Yes.
Thomas Drum,
No.
Lord Nagano,
Yes.
Robert Wilmot,
Yes.
Marie Schad,
No.
Tim Stahl,
Yes.
Terry Wilbur,
Yes.
James Karasik,
No.
Morris Cerbello,
Yes.
Mark Greco has been marked excused, Ralph Stacy Jr.
In the name of freedom and liberty, I vote yes.
Mr. Chairman, that's 20 in favor, 3 opposed, and 2 excused.
Thank you. Moving now to Public Safety Committee, Legislator Wilbur.
Thank you, Mr. Chairman. At this time, I'd like to make a motion to move PS1 through PS11 as a block by consent.
I don't have an 11.
10, excuse me.
Any discussion? All those in favor? Aye. Opposed?
Mr. Chairman, that's 23 in favor, 0 opposed, and 2 excused.
Do I have one pass for next month?
Human Services Committee, Legislator Rehill.
Mr. Chairman, can I slip in next one? I would offer resolutions HS1 through HS4 as a block. And,
Thank you. Any discussion?
Sorry about that.
Was there more?
No? Well, yeah, I was thinking about the one I was going to add.
Okay. It's resolutions HS1, 2, 3, and 4 as a block. Any discussion? All those in favor?
Aye.
Opposed?
Mr. Chairman, that's 23 in favor, 0 opposed, and 2 excused.
Thank you. Economic Development and Planning Committee, Legislator Stahl.
Thank you, Mr. Chairman. I'd like to move resolutions EP1 through EP3 as a block, and I'll also note that I'm going to be abstaining from EP3.
Thank you. Any discussion? All those in favor?
Aye.
Opposed?
Mr. Chairman, that is 22 in favor, 1 abstained, 0 opposed, and 2 excused.
Thank you. Resolution EP4 by Legislator Stahl.
Thank you. I'd like to make this motion and urge its adoption.
Will the clerk please read the heading?
Resolution of the County Legislature of the County of Oswego, New York, approving the Oswego County Civic Facilities Corporation refunding revenue bonds, Series 2021, Oswego School District Public Library Project, issued in an aggregate principal amount not to exceed $5 million.
All right, and this does need to be amended. I'd move to amend to add the date of September 30th, 2021 on the second page.
Second.
Thank you. So,
As the publication date?
Yes, that's correct.
yes, that's publication date. So, all those in favor of the amendment?
Aye.
Opposed? Carried. So, back to the original. Any discussion? All those in favor?
Aye.
Opposed?
Mr. Chairman, that's 23 in favor, 0 opposed, and 2 excused.
Thank you. Moving now to Health Committee, Legislator Caressa.
Mr. Chairman, fellow legislators, I move to move AT1 through AT4 as a block.
Thank you. Any discussion? All those in favor?
Aye.
Opposed?
Mr. Chairman, that's 22 in favor, 0 opposed, and 2 excused.
Thank you. Infrastructure Facilities Technology, Legislator Walpole has none.
Hey, Chairman?
None. We'd love to hear from you, though. Moving now to Finance and Personnel Committee, Legislator Martino. Thank you, Mr. Chairman. I offer this resolution and urge its adoption.
Will the clerk please read the heading?
Resolution amending the drug-free workplace policy for the County of Oswego.
Thank you, Mr. Chairman. This mirrors New York State's policy, drug policies, as to include marijuana use as not letting marijuana use in daily practice through the county facilities.
Thank you. Any discussion? All those in favor? Opposed?
Mr. Chairman, that's 23 in favor, 0 opposed, and 2 excused.
Thank you. Resolution FP2 by legislator Martino.
Thank you, Mr. Chairman. I offer this resolution and urge its adoption.
Will the clerk please read the heading?
Resolution authorizing professional services contract, Human Resources Department, Safety Services Consultant.
Thank you, Mr. Chairman. This is through our HR department. It is listed and received an RFP to help oversee our compensation workers. Workers' compensation cases throughout the county and neighboring towns who use this.
Thank you. Any discussion? All those in favor? Opposed?
Mr. Chairman, that's 23 in favor, 0 opposed, and 2 excused.
Thank you. Resolution FP3 by legislator Martino.
Thank you, Mr. Chairman. I offer this resolution and urge its adoption.
Will the clerk please read the heading, but this does need to be, okay. Clerk, please read the heading.
Resolution authorizing budgetary modification, Office of Strategic Initiatives and American Rescue Plan funds.
Thank you, Mr. Chairman. There is a small amendment on this resolution. It would be on page 2 of the budget mod itself. Budget line 5465 needs to be changed to 5438.
Thank you. On the amendment, any discussion? All those in favor? Opposed?
Mr. Chairman, that is 21 in favor, 2 opposed, and 2 excused.
All right, thank you. Back to the original resolution as amended. Any discussion? All those in favor? Opposed?
Thank you, Mr. Chairman.
Mr. Chairman, that's 21 in favor, 2 opposed, and 2 excused.
Thank you. Resolution FP4 by legislator Martino.
Thank you, Mr. Chairman. I offer this resolution and urge its adoption.
Will the clerk please read the heading?
Resolution authorizing budgetary modification, American Rescue Plan funds.
Thank you, Mr. Chairman. This is actually setting up the proper budget lines out of our budget and placed separately for the ARPA funds.
Thank you. Any discussion? All those in favor? Opposed?
Mr. Chairman, that's 23 in favor, 0 opposed, and 2 excused.
Thank you. Resolution FT5 by legislator Martino.
Thank you, Mr. Chairman. I offer this resolution and urge its adoption.
Will the clerk please read the heading?
Resolution allocating American Rescue Plan Act funds to Oswego Health for a medical worker recruitment and retention program.
It is exactly what it says in the heading. This is funds going to Oswego Health for worker recruitment and retention to keep them on board. This does coincide with fall deadlines for ARPA monies.
Thank you. Any discussion? Legislator Stahl.
Thank you, Mr. Chairman. As we heard earlier today, we all know the difficulties that we are facing when it comes to medical worker recruitment. We heard that resolution earlier, and there was some discussion about resolutions that need to come forward to address real-world problems. I want to thank this legislature for putting this forward. This is a real-world way of addressing a real-world problem, and I want to thank them for this $500,000. They know that this workforce is sorely needed, and recruitment and retention program, I think, is going to be excellent. So thank you again.
Thank you. Any other discussion? All those in favor? Opposed?
Thank you, Mr. Chairman.
Mr. Chairman, that's 23 in favor, 0 opposed, and 2 excused.
Thank you. Any unfinished business?
Mr.
Chairman, I'd make a motion to waive the rules to consider one resolution, PS 11.
Now you're getting it. Yes, we have a motion, do we have a second? Second. All in favor? Aye. Thank you. Legislator Wilbur.
Mr. Chairman, I'll offer this resolution and urge its adoption.
Will the clerk please read the heading?
Resolution authorizing the chairman to execute a retainer agreement with Burt Scolomero and Hurd LLP to conduct an independent investigation into an inmate death.
If that sums it up, Mr. Chairman, I urge everybody's support.
Thank you. Any discussion? All those in favor?
Aye.
Opposed?
Mr. Chairman, that's 23 in favor, 0 opposed, and 2 excused.
Thank you. Any miscellaneous business? Legislator Wilbur.
Thank you, Mr. Chairman. I know we gave a lot of credit earlier to a lot of individuals and a lot of organizations. I would be remiss if I didn't take the opportunity to congratulate our great 4-H program on their centennial that they're celebrating this year. Couldn't believe that I was here for the 90th and now I'm here for the 100th. So congratulations to 4-H, Linda Brush, and all the volunteers who organized that such a successful program across the county.
Thank you. Anything else? At this time, just so everyone knows, we will adjourn our meeting and then we'll go to the public comment period. So, looking for the appropriate motion?
A motion adjourned.
Yeah, all in favor?
Aye.
Opposed? We stand adjourned. Now, as far as public comments, Legislator Wilbur. Okay, we'll go back to the first list. Chris Davis.
Permission to stand up there with him, sir?
Yes, sir. You take the podium. You have 5 minutes.
Hi, my name is Chris Davis. I stand here before you everyone today regarding two discussions regarding the same matter. First, my son Connor Davis, that was taken from me from the accident, was on Churchill on 481. I put a memorial up. I put a memorial up for him in front of the jail, and a week later they took it down. And I talked to Dave Turner, which told me that the county was going to start taking all the memorials down, and the state was going to do the same. So I sat back for 2 weeks, and nothing happened. So I went ahead and put up my son's memorial up for him, and I think I emailed you and I got no response. I called the clerk. She said she was going to contact you, and I still didn't get a response. So all I want is to be able to honor my son where he was taken. And I can't get a response out of anyone other than they took down what, and I put all respects into the matter of putting something. I didn't put something up there that looked like trash.
I know this is a hard time for you, but Legislator Wilbur and I had discussed your very situation. So if right after the meeting, if you could get with him, we might be able to at least discuss that.
Okay, thanks.
Just to kind of go through the other reasons why we should be up here. You know, why his piece was singled out where many others still stand on county property, county roads in Oswego County. When I brought this discussion to the attorney, he replied that memorials are not allowed, yet many still stand strong, proudly serving as a reminder for our lost loved ones. If this is a law, why would my actions be singled out? I'm asking that my memorial be allowed to be installed upon further discussion or a meeting, like you have mentioned, thank you, regarding the discussions of our county system. I set up a petition with over 950 signatures to have my son's memorial put back to its rightful place. I'm asking for everyone to walk in my shoes for just 1 second, although I hope this truly never is felt by anyone else. Second, I ask for, because this is a tragic intersection, there's been many losses at this intersection, that something be installed on this Churchill and 481. It's a dangerous intersection where we've known that this has caused many accidents and many, families to lose loved ones. So, thank you for your time.
Just so you're aware, we did send a letter to the state about that intersection. I understand they're doing. Mimi Goulet. Okay. Moving then to Stephanie Hoxie. Thank you.
Good afternoon. My name is Stephanie Hoxie, and I have worked for Oswego County, specifically at the Department of Social Services, for the last 12 years. In my time at DSS, I have been a community service worker in the HEAP department, a social welfare examiner and temporary assistance, a senior social welfare examiner responsible for training all new examiners that come into the agency, and currently as a staff development coordinator. In my current role, I have the pleasure of welcoming all new staff to our agency and sharing with them just how much I truly love our work family, and that there is no work family like our DSS work family. This is my oldest daughter, Cameron, and so I struggled today with whether I would come here and talk because I feared that it wouldn't make a difference or that my voice wouldn't be heard. And I always use Cameron as my true north. So I said to myself, what would I tell Cameron to do? Because I always have her best interest at heart. So here I am. I was born and raised right here in Oswego County, and my dad worked for the county for 25 years when he retired. He taught me that a county job was a great job to have, and it really was. The pay was competitive, the benefits and retirement packages were great, county jobs in my eyes were sought after. As recent as 10 years ago, caseworkers sat on lists for years waiting to get into our agency, waiting to be hired. So once you got in, you didn't want to leave. I'm afraid this is no longer a reality, and that worries me. For the next 20 years, I will work side by side with and welcome new staff that are currently being paid far less than other smaller counties. Staff that earn sick and annual leave at a rate that is quite honestly embarrassing. It takes new hires 5 weeks and 1 day to earn 7 hours of annual leave, and then they aren't even allowed to use it for 6 months. You will hear staff refer to Tier 4 as the last good tier. How did that happen? How did we get here? All county employees should have a good tier. New staff that are entering our workforce are given zero incentive to stay, and longevity is being sacrificed because of it. Our county has become a training county. We pay for staff to be trained, we send them out of county to Albany and invest in them wholeheartedly, and they leave for higher paying positions in neighboring counties. Our incredible in-house trainers that pour their hearts into training and building up successful staff are exhausted from the revolving door of new hires. Today I have a big ask. I am here to ask for competitive salaries for all staff. I could go through the numbers and pay rates all day, but I am confident that you already know the pay rates for the staff in our county. Counties that are smaller than us are paying their staff $1 or more per hour in comparable titles. It's time that we take a step forward and offer our staff a reason to stay. I want to know that when someone is hired, they're not quickly making their exit plan because the pay really isn't that great and longevity raises are not worth it. If there wasn't ever a time to take that step, it's now. As an employee of the county, I thought that we were your people. We were here to work together for the greater good of our community, and it is painful to me to feel and to see my work family feel like they are not valued as employees of this county. These are my people, and my people deserve better. I heard legislators today say that county employees moved to mountains over the last 2 years, that they did a wonderful job. Show them that. I just want to leave you with one question to ponder. What would you do if your child wanted to work for Oswego County? Would you encourage them? I have other letters here that other staff have written who are not able to be here today. Can I leave them with someone? Thank you.
Thank you. Thank you. Jacqueline Robinson. Thank you. You have 5 minutes.
Thank you. Sorry, I'm short. I'm here today to not only advocate for myself, but for my coworkers, but to advocate for my entire DSS family. No matter their job title, I am here to represent the DSS employees that have been undervalued by our county for far too long. Many of them could not be in attendance today, as leave time is extremely limited for most of our staff. The risk of using the little time they have saved up is far too risky during a global pandemic. Some couldn't sacrifice the time with their clients, and others are working on short-staffed teams and felt that they couldn't step away. My name is Jackie Robinson, and though I'm not a famous baseball player, I'm a principal social welfare examiner and assistance programs. My team and I work with the ever-growing homeless population in our county. Trying to find them housing in a county where affordable housing is scarce is not an easy task, especially considering the biggest barriers of the population we are serving is not their homelessness. In my last 11 years with DSS, I have seen a huge shift to the population we are serving. Regardless of our job title, we have inevitably become mental health providers, case managers, and de-escalation specialists. The population in which we serve are battling untreated mental health and addiction issues that have now only been exacerbated by COVID. Even after 2 promotions, I am still not considered the breadwinner of my family. Not even close. After all my deductions, including my hefty health insurance premium, I bring home less than a McDonald's and Dunkin' Donuts worker staff gross. When my 17-year-old niece left for college in August, she was making $15.75 an hour at her job at McDonald's. And guess what? Those are the jobs people are going for. They are the ones people are applying for. Our entry-level positions can't even compare to those wages. More money, less stress. Can we even blame people for not applying for our jobs? Here are some facts. Just a year ago, milk was $2 a gallon. Yesterday, I paid $3.20. That's a 60% increase in 1 year. Keep in mind, I'm a mom to 3 boys, 2 of which are teenagers, so it takes about 3 gallons to sustain my household on a weekly basis. Last year at this time, gas averaged $2.22 per gallon. Today, $3.35 per gallon, a 51% increase. These percentages have made a huge difference to my budget. But remember, I'm not the breadwinner. Let's not even get into the increases to child care costs and National Grid bills. We have single parents working within our walls trying to support their families. We have staff leaving their DSS jobs only to head to their second job so they can pay their bills. Our staff, your staff, are struggling financially. We are the working poor working with those living in poverty. Ironic, isn't it? And these are not easy jobs. Have you ever sat in front of a homeless mom and her children because they fled a domestic violence situation and had nowhere to go? Been escorted to your car by a sheriff's deputy because they feared for your safety because you just met with a disgruntled client? Seen a man with a screwdriver sticking out of his head and his really intended target was a DSS staff person? I was there, I saw that. Remove children from a home, changed your clothes after a home visit because you fear what's on them and what you have to get into your car and take home to your children? Daily, we are directly involved in people's 2 most prized possessions, their money and their kids. It is a thankless job. We worked through a shutdown to keep the needs of our community met. Many of us working in the agency the entire time because that's what we needed to do. Remember that time when county highway workers were sent home for almost a month during the shutdown with full pay? That wasn't an option for us. The needs of our community did not stop because of COVID. I have dedicated my life to human services. This is not my job, this is my career. And despite the many times my husband and children have begged me to walk away because I've been undervalued and the stuff that I deal with on a daily basis is not worth it, I'm still here. I'm still here because I care. I care about the people I serve, but I also care about my incredible work family. You guys have really good people working for our DSS. They work feverishly to serve this community. I am tired of losing some of the best staff to higher paying, less stressful jobs. Our agency has now become a stepping stone for other jobs. And for the record, I voted no to our last 2 contracts because they weren't enough to keep people at our agency. We deserve better. Today, we let our voices be heard. We are united and we are DSS strong.
Thank you. Kelly Hurlman.
Should have never signed after her. Well, they were great speeches. Thank you. I'm actually going to read for another person after I'm done with mine, so I'm going to try to keep this short and sweet. My name is Kelly Hurlman, and I'm a senior caseworker in the Child and Family Services. I have lived in Oswego County for most of my life. I graduated high school in Hannibal and a proud graduate of SUNY Oswego. I've raised my family here and I pay taxes here. I have been employed with the county since 1996. I have been a services caseworker, a CPS investigator. I have supervised contract agencies, family services staff, caseworker aid staff, and CPS FAR staff in my time with the county. I am currently in the role of coordinator of training for our casework staff. I currently interview and onboard all of our caseworker staff as well as provide them with various trainings, help them develop their skills, hold groups to develop critical thinking skills, and I also provide ongoing trainings and support for all of our staff. We need your help. The county must make efforts to retain staff. In preparing for this today, I knew that turnover was an issue, but I didn't have time to dwell on it. My work was on. But looking at the facts, I am disappointed and scared for the future of the county that I love and our most vulnerable populations due to our lack of experienced staff. When fully staffed, we have 77 full-time caseworkers and 1 part-time caseworker in Child and Family Services. From April of this year until October, I have exhausted 3 civil service lists. Since May of this year, we have hired 19 new caseworkers with another 7 starting on November 1st. When Stephanie said I'm exhausted, I am. Some of those caseworkers that were hired in May are already up to caseloads of 10. That may not seem like much, but not only does everyone open for services need to be seen twice a month, there are notes to document those contacts, collateral calls to be made, services to refer to, court summaries to write, and the list goes on. I started this position on 11/25/2019, and since December 8th, 2019, I have started, and as of November 1st, I have started 50 new caseworkers. Of the 43 that have entered through our doors, 36 are still with us. 46% of our child welfare staff have less than 2 years of experience. It takes at least 2 full years to train staff and build skill sets such as how to confront on difficult topics. Training is ongoing for all child welfare staff. When a caseworker starts, it could be up to 6 months for them to get their own cases due to the state training requirements. 68% of our current staff have less than 5 years. Of our current average experience for caseworker, it is 4 years. We have no workers with 15 or more years of experience at the county. Without an experienced staff, things will and they do get missed and could end up in tragedy. Our state and federal mandates don't change due to a lack of staff. With retention of a full experienced staff, outcomes for our county's most vulnerable population could be different and cost the county less in the long run. Placements could be prevented. The human cost of our lack of experienced staff takes a huge toll on everyone at our agency and within our community. Caseloads are higher, things get missed, less time to do actual caseworker as we are too busy putting out fires or crises. Children needs go unmet, contacts are missed, our liability goes up. Within our agency, we cannot say we are too busy, we have no more openings. We must meet and perform our jobs, even when caseloads are at a maximum. We cannot turn people away. So when we experience turnover, those left must not only pick up the unfinished cases from the employee that but they continue to get new ones. When we have a hiring freeze, the stress for those of us working gets enormous. Think of the families we serve. Some are on their 5th caseworkers due to staff turnover, and think about having to open up to 5 different strangers about why you were involved in the child welfare system. This isn't helping families to make lasting change. Bodies aren't enough. We need to retain and continue to develop the staff we have so that we can continue our various missions in serving our county and prevent tragedy. We must retain staff so that those promoted have the skills to manage staff and help with the various demands of our job. I am proud of the caseworkers and all of my DSS family that I work with, and all the staff of the department. They are some of the most genuine, giving, supportive people I have met in my entire life. Please consider giving caseworkers and all agency staff what their passion and dedication to our mission is worth. I worry that without the county moving to a more competitive salary and longevity raises, we will continue to lose our experienced staff and will continue with staffing shortages. Thank you. That was fine. This one I'm going to try to get through without crying, okay? I'm reading this for a close friend at the agency who couldn't be here today. My name is Erin Pickrell, and I'm a community service worker at DSS. I have worked for the county for 3 years. I make $15.15 an hour. That makes my gross yearly earnings $27,573. That's before taxes, before union dues, before health insurance. I have been with my husband for 8 years, married for 2. We have tried to conceive naturally for 4 years, resulting in no pregnancies. I am infertile. Did you know that after 1 consecutive year of trying to conceive resulting in no pregnancies, you are considered to be infertile? I did. Have you ever laid naked, alone, vulnerable, anxiety-ridden, and depressed on a cold examination table just to be told you will never conceive a child naturally, and there's nothing more we can do unless you self-pay? Your employer does not cover fertility treatments. I have. There I lay, naked, afraid, alone, vulnerable, anxiety-ridden, and depressed on a cold examination table, having my heart ripped out and my dreams shattered, tears stinging as they rolled down my cheeks. Do you know how much donor sperm costs in our area? I do, $700. Do you know how much donor eggs cost in our area? I do, $4,000. That's $1,000 an egg. However, you have to purchase, for the lack of better terms, a minimum of 4. Medications for 1 round of in vitro fertility treatments are $2,200. The actual in vitro fertilization can range from $4,000 to $6,000 in area. Adding all the costs up for 1 round of simple in vitro fertility, I can't talk, sorry. I'm trying to get through it without crying. Fertilization in our area is $12,900, or roughly $13,000. The national average is $33,250 for 1 single round of IVF. Now remember, I gross $27,573. $13,000 is more than half of what I take home annually. 1 in 8 women, or about 7.3 million American women, experience difficulty conceiving. I am that 1 in 8. We are told becoming a mother is easy, it's natural, it's magical. For those 1 in 8, for me, it's not easy, it's hard, it's not natural, it's man-made, and it's science. It is far from a magical experience. It's waking up at 4 a.m. to administer injections to yourself or having your loved one administer your injections for you. It's constantly hoping, praying, wishing for a miracle because you can't afford IVF treatments. It's spending half of your yearly income on IVF treatments because the insurance you pay for doesn't cover it. Do you know what employers do cover fertility treatments? I do, and here are a few. Starbucks. A barista at Starbucks in Clay starts at $15.50 an hour, more than I make as an hourly as a county employee. All part-time employers who work 20 hours or more a week are eligible for insurance. That insurance will cover up to $35,000 in IVF treatments or other fertility treatments, medications included. DoorDash. Drivers for DoorDash that work part-time 20 hours or more a week are eligible for insurance. That insurance will reimburse employees and or their partners up to $20,000 for IVF or other fertility treatments, medication included, annually. Lowe's. Sales associate at Oswego Lowe's start at $15.75 an hour. Again, more than I make an hour as a county employee. Employees that work full-time are eligible for insurance. That insurance covers up to $30,000 for IVF or other fertility treatments, medications included. I can go sell coffee part-time. I can go deliver fast food part-time, and I can go sell paint and lumber full-time, and I have IVF covered. But I, as an Oswego County employee, cannot have my fertility treatments covered. I cannot grow my family as an Oswego County employee. Instead, I sit naked, alone, vulnerable, anxiety-ridden, and depressed on a cold examination table, having my heart ripped out and my dreams shattered, tears streaming as they roll down my cheeks. Thank you.
Thank you. Christopher Despain.
Well, I'm going to try to follow up that as best I can here. My name is Chris Despain. I've worked for Oswego County for approximately 12 years. I graduated from SUNY Oswego from this county, and I've lived here, and I love it here. Worked for family services, preventive services, child protective services, and now adult protective. I've worked very close with other community providers such as our mental health unit, fraud, public assistance, probation, law enforcement, and corrections. These are the folks, including ourselves, child protective services, and everybody at DSS, who are keeping our community safe, healthy, people off the streets, and productive members of society. For approximately the last 6 to 8 years, I have seen a turnover rate that can only be described as unacceptable. Many of my coworkers have left for other, better paying jobs that don't even involve the community, other positions. Even worse, they're transferring laterally for other counties for higher paying jobs, such as Onondaga County. Now we have new staff constantly cycling in and out of the department. If I were to estimate, at least 50% of the staff are new or inexperienced, which is very scary to me. I don't even recognize a lot of people in the building at this time. Oswego County is paying for and losing huge sums of money to train people who have only stayed a year or less. High turnover rate and inexperienced staff is not only costing the county money, it's adding to substantial risk to the people of this county, including people inside this room. My wife has gone back to school to get her master's degree to become an occupational therapist. I have 3 children, which makes me a family of 5. With my salary at this current point in time, I am eligible for public assistance. The only solution that I can see is to incentivize the positions at the Department of Social Services. These positions that are extremely important for not only the people of this county, but for others even outside. I am just hoping today that everybody can hear me and hear the people from the department that have come to speak and take it seriously. These pay rates are not only just crucial, but it's something that we deserve and it's something that we are worth. And I appreciate all your time today. Thank you.
Thank you. Tiffany Bivens.
I'm going to read from paper because I'm not well versed on the fly. Good afternoon. My name is Tiffany Bivens. I began working for the Department of Social Services back in 2011. I recall vividly interviewing with Marty Babcock and Jeremy Belcom during month 6 of my pregnancy. I went into the interview somewhat defeated, as I had already faced rejection from several other agencies for that very fact, despite my qualifications. I am sure you can imagine the relief I experienced when I received the call asking if I would accept a county job with the Department of Social Services. What stuck out in my mind more importantly was when I thanked Marty for not looking at my pregnancy as a reason for disqualification, she looked at me with the calmest of faces and said, "I have hired you 9 months pregnant." It was the first time I had felt authentically valued as well as supported by my employer. Between 2011 and 2018, I primarily served as a social welfare examiner within various assistance programs. In 2018, I left the agency for the education field. At my exit interview, I remember explicitly stating that it felt as though it was nearly impossible to make headway on certain changes within the Department of Social Services due to the pushback from the legislature and lack of education and understanding on your end about our programs. When COVID hit at the end of 2019, I monitored how both organizations responded. The organization that I had currently worked for and how DSS responded. In the education field, there was disconnect, uncertainty, and a lot of failed communication. I watched several people of power continue to make 6-figure salaries, but not produce anything. Then I watched the Department of Social Services. The CPS workers weren't on TV asking to be labeled as frontline heroes. They showed up and did the work. The management team had banded together for yet another crisis and developed an immediate plan of action that still allowed their staff to continue to serve the most vulnerable folks in the community in a timely and expedient manner. They put the pedal to the metal, so to speak, and that is something I have always admired about the culture here at DSS. It is also the reason why I had asked to come back in November of 2020. I find the work ethic of the staff here like none other. We don't give up and we don't give in. With that being said, I understand your positions and what your job entails. I understand your need to remain fact-based and fiscally conservative when making economic-based decisions. That is why I have prepared a list of facts to be considered when making these important decisions that will affect both our futures and the community as a whole. So I kind of have this divided into three different topics that I feel are contributing to the high rate of turnover. So the first would be inadequate pay. So fact, DSS state and federal reimbursements create revenue for the county of Oswego. Source, page 85 of the budget. All pay grades below 5 are not commensurate with surrounding counties or even the state's minimum wage, which has created a workforce gap in our agency. Source, look at our contract. An entry-level Spirit of Halloween employee makes $22 an hour. I make $18.55. I handle a caseload of over 300 SNAP and TA cases. COVID funds, fact. Oswego County received $22.7 million in COVID relief. New York State COVID relief, that's all public knowledge. Any DSS employee hired after 2013 can only accrue a maximum of 6 sick days per year. Source, contract. COVID testing for children can take 24 to 72 hours in order to produce a result. Oswego Health Department. Use of personal sick time during September of 2019 versus September 2021 increased by over 60%. Source, HR. Staff could not present today as they have ran out of time and cannot afford to go the time without pay. Source, DSS staff that aren't here. The third part is women in the workplace. DSS's workforce is over 85% female. Source, HR. Over 65% of those females are working moms. Source, HR reported HH demographics. The Highway Department, Sheriff's Department are predominantly employed with males. The Highway Department and Sheriff's Department have received increases. So I have 3 questions. What justification can we provide to our staff as to why we cannot get an honorable and well-deserved pay increase? Why does the county not utilize COVID aid to assist DSS staff from having to go time without pay or prevent depletion of sick time? What are you doing to prevent the working moms in our agency from throwing in the towel and going from the cubicle to the front of the lobby? In closing, I have faith and hope that big changes are always possible. This organization worked hard on creating a culture shift, and they had an entire agency assessed. Now I'm asking that you do your part, as you all know you have the power to do so. I ask that you help us avoid even further turnover. You, I, and everyone else in this room knows what's coming down the pipe from the federal government. We as employees can already see the increased emphasis on expansion of social welfare programs as part of the new infrastructure plan. If things proceed at this current rate, the need for assistance will only continue to expand, while the workforce will continue to diminish. At this point, it has become pretty black and white and eminent that we need to make a change if we want to avoid that outcome. Thank you.
Thank you. Shannon Horning. Thank you. You have 5 minutes.
Good afternoon. My name is Shannon Horning, and I work for Child Protective at the Department of Social Services. I have been with the agency for over 7 years and have worked in other nonprofits in the same field for over 25, all in this community. I see some familiar faces out here. Some of you I know personally, or some of you I've worked with professionally. I'm going to talk today about my own stories, but I just want to let you guys know, I know you guys know who your voters are, and I know that this stuff is compelling to you today, and I really ask you to take it seriously. The biggest information I want to get out there is that we as caseworkers make considerably less than the surrounding counties. In addition to making less, our raises come 1, 2, 5, and 10 years, and that's also not the case for other counties. I have personally done the research, and I have numbers with me today. I'm happy to leave so you guys can check them out yourself. I called each HR department myself. There's only one county that is contingent to us that begins at a lower pay rate, but their raises are more often and more substantial. I have also added in the fact that our case numbers, which is public information, come at about the same rate and about the same number. The bigger counties do have more numbers, obviously, but they also have more caseworkers. So when it comes to fairness of distribution, I would call it. There's no difference in the work expectation from county to county, as most of our work is state mandates, but I can also assure you our county strives to do better than most of our contingent counties. So what I'm saying today is that we are paid less to do the same job than all of the surrounding counties, and comparatively, our numbers for reports and caseworkers is about the same. I very much support all of our county services and would like to see everybody in a better position, but today I'm here to advocate for caseworkers and child protective service workers specifically. Over the years, I have heard generally what most of you do for a living, and at times you have asked questions or come to the agency to get a better idea of our job description for what caseworkers do, but I'm not sure if any of you have ever really put together what goes on at this job, as it's vastly different from most of yours. Caseworkers get reports and have to go to people's homes, sometimes unannounced. We do not have a badge, and we actually have very little authority. When we go to people's home to tell them they're not being successful parents, or that they have other issues that could become legal, all we have to offer them is our time and our training. And at this time, frankly, the caseworkers feel like our time and training is worth less. People in the community have called the agency or called us anonymously, and sometimes those people have even been legislators, believing that caseworkers should be able to go to homes and demand changes, or that caseworkers should just remove children. How easy would any of you make it for me to come to your home and take your children, and also do so between 8:30 and 4, as well as have a good place with caring people for them to go to, also between the hours of 8:30 and 4? Whenever I hear people think this is easy, of something that can just be done, I wonder if people really know the essence of our job or the true safety standard that New York State has mandates for. I wonder if people know how family court works, or that we cannot do anything without a judge's order. I wonder if people know that when the judge orders the Department of Social Services to provide visitation and supervise it, it means the caseworker has to do it. It means that we have to change our schedules to accommodate these visits. We do not have evening staff or weekend staff. In general, caseworkers work 8:30 to 4, right? Wrong. I think people who vote on this budget and have had a hand in deciding how much this job is worth should ask more questions to more people. I believe there should be more open discussion with actual caseworkers about what this job entails, and not just by management or other people outside of the agency who know what caseworkers do. Don't get me wrong, I have very much respect for our upper management, and I believe that all of my supervisors would tell you that I always do what I'm asked, and I truly believe that if anybody is deciding on my worth, they should take my opinion into account. I encourage anyone making decisions about career caseworker jobs, including pay, benefits, or standards, to take the time to learn about the individuals at the job. I'm aware of the career path so many of you have taken, and I would say it's vastly different from what we do. I'm not sure I could walk into any of your businesses or homes and decide over a few conversations how much you're worth. I can tell you that I personally did this job for a long time as a single mother, and although the hours are 8:30 to 4, workers are often expected to work late. If you get a case at the end of the day, you have to scramble to find childcare, which is not always easy, or cancel important plans, which frankly gets to be disappointing after it happens a lot. In addition to finding evening and or weekend childcare when you're called out on call or during the workday, you're missing out on important family time and community activities. As a caseworker, when you work late, you absolutely get paid for your time, and I don't want anybody to think that I'm saying the agency doesn't take care of us, but it does make it difficult because we're expected to flex out our time, which means we have to inconvenience ourselves by coming up with another plan or changing our schedule, but we still have to do things like make sure our child care is paid for, since you have to pay for that ahead of time. Our agency always makes sure we get paid for our time or get comp hours, but I'm not sure how easy it would be for all of you, especially if you were a single parent or have young kids, to switch your schedule all the time. During my time as a caseworker, I've been assaulted twice and have had to have people arrested and get orders of protection. On 2 other occasions, I was told that I wasn't leaving homes, and I can tell you I felt very unsafe. It did take a lot of work for me to get out of those homes safely. One of those men who once threatened me followed me back to the office after a second time that I had to go visit him, alone, but it was made in a public place, so people think that's safe. Well, he followed me right back to the office. Granted, I had support from my supervisors, and the sheriffs were there, and I talked to. They made me feel better once I was there, but during the situation, it didn't help. That man, a few months later, ended up in a standoff with the sheriffs, and his life was taken. Again, I want to remind you, we go to these visits by ourselves. We do not carry any self-defense weapons, nor do we have the power or authority to arrest anyone. On the regular, we go into homes with people who have mental illness and sometimes are violent, not to mention they have unfriendly animals, lice, fleas, bed bugs, general unsanitary or unsafe conditions, which we have to maneuver around. So while you're thinking about the budget and how much the caseworker jobs are worth, I want you to think about how many of you would like to be in that position, or better yet, how many of you would like to send your loved ones, such as your wives, your daughters, or your sons, into that situation. At this time, probation officers are a pay grade higher and no longer allowed to do unannounced visits unless they're on a special team where they go in numbers and they have the ability to arrest if needed. Caseworkers have ailing parents, small children, and their own health concerns on top of literally attending to the needs of every family they work with. This job has a lot of expectations and honestly is deserving of a real pay scale revamp. We are not fully staffed and have not been for more than a couple months for years. I know some people are not cut out for the job, and I fully understand that. But I can tell you, we are losing a good number of caseworkers due to people taking similar jobs within this county or literally the same exact job in other counties due to the pay scale change. A good portion of our probation department are past caseworkers, and several have gone to other counties to do the same exact thing. Thank you for your time today.
Thank you. Lastly, we have Jen Burgess. Thank you. You have 5 minutes.
Hi, my name is Jennifer Burgess. I'm a caseworker for the Department of Social Services, and I've been there for 10 years. Today I'm reading a letter on behalf of a colleague. My name is Brittany Bruce. I wish I could be there in person today, but since I only earn 10 annual days a year, I did not have the hours to spare. It is also payroll day for us at DSS. Yes, you heard that correctly. I am a typist, being paid $14.58 an hour, who processes payroll for 300 plus employees in our department. Although I could not be there, I appreciate your time and willingness to hear my story. I work in administration at DSS, so I am seeing our turnover rates firsthand. As the civil service lists come out, we're hiring as many as we can, but it feels like we're losing just as many at the same time. People are deciding that now is the best time to retire. Some people are going to other jobs or other counties that pay more. Some are moving out of the county or even the state because of the situation we are all in. A couple of months ago, we had a new employee start their first day and then not return for her second day. Her reasoning was that the pay wasn't good enough and she made more at her last job. After all the paperwork and the organizing that goes into getting these new hires started, she just decided not to return because the money wasn't worth it. Something must change if we are going to retain the employees we need. With the COVID relief money the county has received and the hiring freeze we had for over a year, financially now is the perfect time to make changes. I have been a typist with DSS for 2 years, a position that I have had to pass an exam to get into. In those 2 years, I have had to hold a second and at times a third job. Currently, I'm a server at Olive Garden part-time. Before that, I worked part-time at Dunkin' Donuts. I was getting paid more an hour, $15.50, at Dunkin' Donuts than I was with my Oswego County typist position. Now, Dunkin' Donuts and many other fast food restaurants are paying their employees $16 an hour. Full-time employees at some of those places are receiving the same benefits that we receive at the county: health insurance, vacation, sick time, and 401k retirement. Currently, I could go work at Dunkin' Donuts for full-time, 40 hours, and receive the same benefits while being paid $1.42 more an hour. What are we doing to keep our employees and show them that they're valued? A job with the county has always been viewed as a respectable job, a career, a job that everyone wants, a job that has great benefits and respectable pay, a job that people want to retire from. I'm afraid these things are no longer true. People may think these things until they get that position and can compare, and that is when we lose people. I currently do not have health insurance through the county because I cannot afford to have another dollar taken out of my paycheck, let alone over $100. If my current insurance dropped me, I would have to take the county insurance and I would be in big trouble financially, having that extra money taken out of my already low paycheck. So yes, we have benefits, but there are some of us that can't even afford to take advantage of them. I don't believe we are asking for much. We need our pay to be competitive with the counties around us. We need reasonable vacation and sick time so that we can live a life outside of work. We need benefits that match our values and our titles as county government employees, not that match fast food employee benefits. We are now 10 months into 2021 and do not have a contract or even word that we are close to a contract being agreed upon. We have heard that other specific departments have a contract in place and have received their raise. But here the rest of us are still waiting for a contract, no raise at all in 2021. We need a morale boost now more than ever. COVID has thrown us all for a loop this past year and a half. Most of us have stayed employed. Some working from home and some, like me, still having to come into the building each day. Some of us working on the front lines as essential workers. Caseloads increasing, tasks and paperwork increasing, ways to communicate harder than ever. All of this without compensation, bonuses, or incentives. Mental health issues are at an all-time high. Add to that increased work stress, increased financial hardship, and any other personal issues that you have, a lot of people on the edge. These are the people that vote you into office. These are the people that are ready for change. These are the people looking to you to provide that change. There's still so much more I want to say, but I'll leave you with this. When people ask me what I do for work, I say, I work for Oswego County, but I am just a typist. They respond a little confused. Just a typist? They're thinking county jobs are still where it's at, where you want to be. Once I explain what I do and how much I'm paid, I think it makes a little more sense to them. Unfortunately, I have been made to feel that I am just a typist, bottom of the totem pole, and I believe my hourly pay reflects this statement. Is this how I am viewed to you? Not worthy of a livable wage, not worthy of working only one job and not running myself ragged, not worthy of a vacation, not worthy of being financially stable enough to start a family. I am 31 years old. I do not have children yet. I am just barely making it with just me. I hope you go home tonight and think of all the stories you have heard here today. I hope you are listening. I hope you hear us. Thank you.
Apparently we have a later right.
Oh, my name was on the list.
Really?
Shauna Gilpin.
Excuse me if I... Oh, yeah. You have 5 minutes.
Good afternoon. My name is Shauna Gilpin. I've worked for the Department of Social Services for 15 years. I went to college to get my social work degree with the plans of working at Oswego County Department of Social Services. This is my dream job. This is what I have always wanted to do. I am a single mom of 2 wonderful children. My youngest is 4 years old and my oldest is turning 7. Daycare costs are expensive. If you don't know what daycare costs, call a few and you'll realize. I only have 1 income in my household. 1 paycheck of my 2 almost entirely goes to daycare. I love what I do. I've been looking at other options. I don't have enough money to pay my bills every month, and I use a credit card and hope at tax time I can pay enough of it off to keep going. My option is I can get a second job and see my children even less, but I will have to find childcare for that as well.
Please consider my family when you're looking at our contract. Please consider giving us a livable wage. I work hard, all the people I work hard, they work hard. There are many parents at social services that face these daycare issues just like I do, but they were unable to be here today. Thank you.
Thank you. I'd like to thank you all for attending. Is there anyone else that'd like to speak?
No, Mr. Chairman, I just wanted to note that there is a brief Republican caucus that will start at 3:45, and in that 10 minutes, you and I are going to have that update.
Yes, so anyways, this concludes our regular meeting, and thank you all for coming. Have a nice day.